Hi, I'm Dr. Anna Baranowski, and I'm very glad that we are able to speak with Leslie Korn again. And Dr. Korn is the author of The Rhythms of Recovery, and it is a profoundly rich book that asks and answers timely questions about using an integrative approach to trauma recovery. I have to say it's incredibly deep and it covers a tremendous amount. And one of the things that I wanted to do is share what you've got written in your book, because I think it does a really excellent job of capturing what you're really covering. Rhythm is one of the most important components of our survival and well-being. It governs the patterns of our sleep and respiration and is profoundly tied to our relationships with friends and family. What happens when these rhythms are disrupted by traumatic events? Can balance be restored? And if so, how? What insights do Eastern, natural, and modern Western healing traditions have to offer? And how can practitioners put these lessons to use? Is it possible to do this in ways that are culturally sensitive, multidisciplinary, and grounded in research? Clients walk through our doors with chronic physical and mental health problems as a result of traumatic events. How can clinicians make a quick and skillful connection with their clients' needs and offer integrative mind-body methods that can be relied upon? Now, you cover a huge amount of different issues and approaches within your work, and you tie it all together. I want you to tell me a little bit about how you have approached both the rhythms and the integrative work that you've put together in your book.
Well, thank you, Anna. Thank you so much for having me here for our conversation. It's great to be with you. You know, I began my work as a body worker. I trained in polarity therapy and in craniosacral therapy. And I've practiced for over 40 years in bodywork therapy. And what I found over time is that the people who are coming to me for treatment, who were in chronic pain generally, sometimes acute pain, but chronic pain, chronic physical illness, always had traumatic events in their lives underlying their distress. And they were talking to me on the table. And the kind of body work that I trained in and practice doesn't involve a lot of massage and movement of the body per se. It's very subtle, energetic work. It can be a light touch to a deep touch, but not moving the body around a lot in massage leads the individual to become very introspective and tune in to their emotions while they're being touched. And it was this that led to conversations and even body memories as different parts of the body are palpated, where people expressed, often for the first time, a memory about a traumatic event, often an interpersonal event such as assault or some kind of abuse. Mm-hmm. And so the combination of working with rhythms, of rocking, of feeling the cranial sacral rhythm, of the rhythm of the spinal fluids, the rhythm of lymphatic fluid and blood flow, the expansion and contraction of the skull, all of those rhythms became incorporated into the rhythm of speech and the rhythm of telling the story about what had happened to them. And I found that there were so many ways those rhythms and reestablishing those rhythms became the source of healing.
Wow, so I didn't realize that your background was really so tied into the physical before you started with psychology, and now I have a much better understanding of what you've done with your book, because it makes perfect sense what you've said right now. And yet, in many cases, you know, people who have a background in psychology or clients who are seeing a psychologist, you don't get into touch, and you cover that quite a bit in your book in terms of the taboo of touch and, you know, what that is about. So can you talk a little bit about the taboo of touch and how that maybe doesn't serve us or serve our clients?
Absolutely, and you're right that beginning as a body worker, it was much easier for me to go to the verbal, and that's what took me to the study of psychology, was listening to these stories and wanting to engage in a psychotherapeutic dialogue, and this led me to develop my approach to body-oriented psychotherapy and a contract with clients as a licensed clinician in both disciplines to both talk and touch. And that's a very clear contract. We don't touch our clients in psychology and psychotherapy, and for good reason. If we're not trained to touch therapeutically, then we should not. Mm-hmm. But I think what I became aware of, I actually introduced this work when I was a clinical fellow at Harvard Medical School in the Department of Psychiatry back in the middle 80s. And as you know from my book, I'm a very big believer on the missing aspect of touch in healing people's lives who are severely mentally ill. Our so-called borderline patients who are always traumatized as the etiology of borderline, or are patients who are suicidal, who really want to leave their bodies, the ultimate in dissociation. I found that these are the individuals who need therapeutic touch, who've often been damaged by inappropriate touch. But what I found is this intense fear, particularly in mental health, about touching clients. And as I say, I don't think people who aren't trained should touch clients. But what I discovered was this very entrenched taboo on touch. And if you think back to it, let's go back to dear old Sigmund Freud. Freud began by touching his patients, and then he moved on to hypnotherapy. And if you think about touch, touch is the first language. It is the first language generally between mother and child or father and child. It is the nonverbal language of the body. We touch, we feel, we gaze into each other's eyes. That's the initiation of attachment connection, where we engage in neurobiological attunement. And it's only later that we move into the verbal. Now, one of Freud's mistakes, and he made a few, but he was also right about many things, is that he thought the verbal was a more highly evolved way to communicate. And so somewhere along the way, amongst the many influences that led to this taboo, we began to think that being able to speak our distress in words and treat it in words was a more highly evolved way than the so-called regressive approach of touch. And so it really became encoded in many ways. And as a feminist clinician, I also think that there's a bias against the feminine form of touch, and not only what I'd call female, and both males and females can exert this feminine form of communication, of soothing touch, of balancing touch, of caring embrace that's therapeutic. But somehow we've had this dissociation occur between what is a higher level of communication, hence verbal, as opposed to the nonverbal. And I think it resides in there. I think it begins there at least.
And yet we know from the research that, you know, I don't know if you're familiar with the old monkeys studies where if these monkeys didn't have any contact comfort, they would fail to thrive. And so we understand how absolutely profound comfort is and touch is and a sense of human connection is, and how hungry people are for it, that sense of the warm embrace, we are missing out on something that is so fundamental.
Absolutely. And we understand this as human beings and through the research, but we haven't yet integrated it fully into our approach to treatment. We're making great strides. When I presented these approaches, and as you say, they're not new ideas. Harlow certainly identified the need. Even Reich identified the need for breaking down the muscular armoring that comes out of trauma. So I see myself as part of a long lineage of people promoting the use of therapeutic touch for healing. I think what took me to create the approach that I use is understanding how dysregulated the rhythms, particularly the autonomic nervous system rhythms, become in response to traumatic events. And so much of our natural body functions rely on that balanced rhythm of parasympathetic dominance. For example, digestion. I worked with a number of people who could not digest well because they were in a sympathetic mode and their parasympathetic rhythm wasn't flowing. And we need parasympathetic rhythm to have our digestive juices flow. Or think about the chronic constipation among people who've been sexually abused or raped, the kind of tight holding of the musculature of the colon or the anal sphincter. But all of that goes back to the disruption of the natural psychobiological rhythm of the body. And there is nothing as effective as touch and rocking and a variety of approaches to help someone move back into their innate capacity for that rhythm.
You have some approaches in the book, like the auricular touch that you illustrate, and I thought it was particularly interesting because it takes approach that this is the one that I was talking about. It takes an approach that seems to me to be particularly self-soothing, and I noticed that when clients are able to integrate even very simple approaches to self-soothing, that allows them to have what could be considered even safe touch with themselves, building a relationship with themselves, and offering something that is nourishing, that it can be particularly helpful in shifting out of that nervous system disruption, dysregulation, and into a stabilization or harnessing calm. And I wonder if you'd tell me a little bit about that from your perspective.
Yes, there's no question that teaching some of these tools is going to give our clients opportunities to enact self-care at home. Not every client is ready to be touched by another person. And when I work with clients, I teach them this tool of auricular self-care. I might also introduce them to a therapy dog and have them begin to touch and feel a loving being who is not a source of fear for them, but to begin to reestablish that capacity for tap there. There are so many ways that we can support our clients to bring touch into their lives. I even teach them a self-massage using wonderful aromas and aromatherapy. And so let me talk a little bit about auricular therapy, because touch may not be right for everybody. Sometimes acupuncture or acupressure is the appropriate intervention for a client. Regardless, I teach them about the power of massaging and applying pressure to points on their ear. Now, particularly with our clients who experience traumatic stress and the addictions or self-medication where they're self-harming, whether it's through drugs or alcohol or any kind of self-harming behavior, this is a particularly appropriate self-care behavior to enact, because our vagal nerve comes to the surface of the ear right at the outer area. And so if we apply pressure...
Can you explain why this is? Because you just mentioned the vagal nerve, and it is actually very, very important. So most people will not necessarily understand why that is. So can you describe what makes the vagal nerve of importance, and why touching in this way where the vagal nerve appears is important?
Well, the vagal nerve governs parasympathetic dominance, which is often out of whack. It is often, we're in traumatic stress, we're often in a hyper-reactive mode rather than a relaxed mode. And the vagal nerve is really intrinsic to facilitating a state of relaxation. And so any time that we can self-soothe through access of the vagal nerve, we are changing our own physiological response just by a simple approach of touching the vagal nerve. And we can also, in body work, we do this also by massaging at the diaphragmatic area as well, which is often very tight. And I teach my clients how to do that, or how to give themselves gentle belly rubs as well. Lots of ways that we can soothe ourselves. And you know, before I go into the auricular treatment, just one other thing. You know, we rock our children. When we rock our babies when we put them to sleep, we are inducing parasympathetic dominance. We are contacting vagal response. We put our hand on the bottom of the spine and the upper hand right on their brachial plexus, and we hold them at our heart. And we rock and we bounce and we put them to sleep and we soothe them. But why do we stop doing this? Why don't we do this for our 4-year-olds and our 10-year-olds and our 25-year-olds and our 50-year-olds and our 90-year-olds? We stop this idea of rocking, and rocking is another profound approach to engaging that relaxation response and the connection of attachment that is so sorely missing, particularly in traumatic events. So this very simple exercise about touching the vagal nerve, the 10th cranial nerve, means that we're really going to apply some wonderful pressure along the lobe of the ear. And as you apply pressure using both your thumb and your forefinger, front and back, you can feel areas that are a little tender, and you give that a little bit more pressure and a little bit more massage, and you really do this until you feel a lot of stimulation. I call it kind of hurts, but it feels good. It doesn't hurt enough to make you wince, but you're going, oh, wow, I can really feel that, and I'm feeling a lot of stimulation. Now, in Chinese medicine, where it hurts more shows that there's less energy flow in that area. And so you spend a little bit more time there. And one of the benefits of this is if you pull on your ear and you pull downward, this releases the jaw. And in PTSD and in trauma, yes, that's exactly right, Anna. You pull at an angle, and what you'll feel is your jaw start to relax. There's so much temporomandibular joint dysfunction that leads to headaches in trauma because people grit their teeth under stress. And so when I have a client who has headaches or jaw pain, dental problems with trauma, I teach her or him how to pull and stretch and apply pressure and move up the whole ear along the outside and continue pulling, and then you find yourself inside the ear. Oh, I'm feeling so good already. And then you're applying pressure on the inside, and you can even use your forefingers to find some of those acupuncture points that are part of what's called the auricular acupuncture protocol. You don't need to go to an acupuncturist for it, though it's a good idea to do that also. You can contact these points that help reduce cravings. They help recovery from the addictions. Oh, I feel so energized right now. And they give you an opportunity to really revitalize yourself, because we get so tired and fatigued as a result of the effects of trauma. How do you feel right now after doing that?
I have to tell you, that was very interesting, because you were talking, and then when I put my hands on my ears, particularly when I was stretching out, I got this big smile on my face, and boy, it just kind of came naturally, and that was very surprising, because that I just noticed it as I was doing this. It's a very, very simple and soothing exercise, and it just kind of lowers the volume of whatever's inside, right? And I mean, because I like so much this idea of really being connected with yourself, leaning into wherever you are within inside of yourself and accepting, doing this and leaning in really seems to create a feeling of like acceptance and calm. Like, it's just whatever it is that's coming up, it's okay.
I agree. And this is especially important as a technique when one is feeling out of their body or dissociated. You know, that anxiety or that disconnection that can drive self-harming behaviors. I teach this to my clients, or I practice it myself if I'm feeling dissociated, to bring myself back in, as you say, and it matches that inner calm with the energy that begins flowing. I begin to feel my body again.
So what I would like to do is actually post an image that comes from your book as well, so people can see it while they're actually practicing this little exercise. And I just want to ask you, Leslie, is there anything else that you want to say about the rhythms of recovery before we finish today?
Oh, well, thank you for that question. The book Rhythms is really, I wrote it because I felt there was no complete integrative medicine book on the treatment of traumatic stress. I focus it on complex trauma, and with a particular focus on rape or sexual assault or sexual abuse, even though I do have a number of cases for veterans and people who've experienced war trauma. And in addition to talking about the body, I talk about nutrition, I talk about herbal medicine, I talk about spirit molecules. And so it provides an opportunity for someone to enter into the body, mind, spirit treatment wherever they are in their own self-care. That's really my vision for this book. And it's written for both the clinician, but it's also very accessible for the client.
Yeah, I really got that sense, because you cover such a wide range, and it seemed to me that you were pulling from so many different sources and creating this kind of guidebook that had not just the breadth, but a lot of depth into every little area, and you really support it with a lot of research. So I want to thank you so much for taking the time to speak with me about your book, Rhythms of Recovery, and this amazing integrative approach that you're taking, and just this recognition of how we need to start bringing our body back into our conversations around trauma and rocking and using that auricular approach. And again, I want to just thank you so much for your time, and such a delight to speak with you, Leslie.
Well, Anna, thank you so much. It's always a pleasure to talk with you.
For more Ask Dr. Anna videos and information about post-traumatic growth and recovery, subscribe and like our YouTube videos at What is PTSD, or join us at previous video episodes in our playlist Ask Dr. Anna from the Traumatology Institute team.